everyone, welcome back to my channel. I am Dr. Ann and this is the Health Hub. It's so weird that the first time I actually decide to vlog successfully, it's actually Christmas. So Merry Christmas everybody. So Christmas is my fave, like absolute favorite holiday ever. So but the unfortunate thing about Christmas this year is that I am on call. Yes, so I am on call. I am on call on Christmas Day, and it's a rainy Christmas. Let me show you guys. Okay, so basically, I feel like these Wi-Fi are a bit noisy, so I think I'll just talk when I get to work, really. Just to give you a bit of a step by step on what happens during a call. Ever since, so I'm no longer in clinical medicine. I'm in pathology, and yeah, I'm just gonna give you guys a bit of a demonstration of what happens when one is on.
Like so, indeed, from the indeed, yeah. I see you looking like a snack. Let me see some. You are the wifey type, baby. You could be one. Let me change your life. I could show you many reasons, different seasons. Hop in my bag and I stay in it. Hit from the back and I stay in it. He is like damn.
But anyways, it's just been busy, guys. Like, starting the whole like reg program and everything has just been like weird and like different. There's like exams after exams. There's the M-Med. There's a lot. So anyways, I'll try to sneak in like vlogs. I'll try to sneak in whatever content I can whenever I can. I know it's not nice because then there's lack of
consistency, but
yeah, it is what it is. Yes, in this vlog I just wanted to show you guys like what I do. So yeah, guys, last year December I applied for a post in the NHLS because I was trying to get out of clinical medicine because I just couldn't do it anymore. If you haven't watched my non-clinical medicine options video, please make sure you do after the vlog. So anyways, I was sick of clinical medicine. I just didn't see myself doing calls. I just didn't like doing calls. I feel like I love the job outside of having to like be on call, be up in the AMs, walking around at 3 a.m., pushing beds, cutting in theater at like 5 a.m. Like it was just like, yeah, I didn't see myself like doing that because I'm into self-life, period. I was just like, I don't see myself doing this when I'm 40. So I was just looking for a way out. I'd never thought of pathology, which is weird. But when the post came out last year, November, a couple of people sent me this stuff. So I was like, okay, let me just try it out. I didn't know nothing about lab work and stuff. Like I didn't know anything about it. So anyways, I applied for chemical pathology and clinical pathology. So clinical pathology is like the internal med of lab work. So the whole thing that happens with clinical pathology is that you rotate in chemistry or chemical pathology. Then you go for like 12 to 14 months. Then another 12 to 14 months in micro, another 12 to 14 months in hematology. So the nice thing about it is that I think the job opportunities are better because the expectation is that you're an expert in all three fields and all of that and whatnot. And it's more economical to like hire clinical pathologists. That's why it's hard for you to be unemployed. So anyways, because you have, a bit of everything, literally. So yeah, I applied for chemistry as my first choice. I didn't get it. I got clinical pathology. So I got my second choice. And yeah, I didn't have anything like wrong with it, like a problem with it. I wanted chemistry initially because I was good with chemistry like in first year and I love chemistry and stuff. So I was like, let's try this clinical pathology out because I was just like, okay, it is a component of it anyways. So yeah, I started in April 2023, right? And then from April, that's what I've been doing. My first rotation has been in chemistry, so in chemical pathology. So when you see the lab forms, if you are unaware of this stuff, like what goes where, chemistry is where the UNEs, LFTs, tumor markers, and stuff like that go to CRP. Literally, most of the stuff goes to chemistry. Micro is more microbiology, which is, yeah, you guys should know. And hematology would be the FBCs, the INRD diamonds, and all of that. So, peripheral smears, like, just to mention a few. So, anyways, yeah, that's what I've been doing. I've been in chemical pathology. Yeah, so I'll show you guys a bit about what happens here. The main thing about chemistry is the authorizing of results, or signing out of results. So basically, as registrars, you come into work, you basically just sign out results. Okay. Just sign out results as they come. So when you're on call, so this is technically a weekend call, but it's like a public holiday, 25th, 26th of December. So yeah, I'll show you guys what happens. So I come into work, and the main thing about chemistry is QC, that is quality control. With QC, it's basically just checking the machines if they're working, if they're fine, and all of that. There's things to test whether they are working appropriately, and then after that, you just have to sign out a couple of results, and then you go home. It's technically meant to be 2 hours. So the techs are, and scientists are the people that are actually doing the hard work in the labs. They're the ones who are, running the samples, putting the samples to the machines. Yeah, you can never trust machines, so that's why there's human beings to double check machines. But I think with like progression, with laboratory automation and all of these AI things, like eventually we might not need to work that hard or double check or triple check the machines and the patient's results, because sometimes the results will be produced and then you see that they're looking dodgy. So basically what we do is to triple check and double check the machines and check if the results make sense and if they make clinical sense. If they don't, you call the clinician or the doctor to find out the history, try and make sense of the results. The annoying thing is that you have to know a lot of these diseases. It's almost like internal meds. You have to know literally like everything. Prostate cancer, PSA, like you have to know everything besides treatment much. So you have to know pathophysiology, physiology, like the back of your hand. So yeah, it's quite a lot of studying, but I feel like I can study.
But I cannot be walking around in the hospital pushing beds, putting on drips in the AMs. Honey, no. Can never be me.
So anyways, yeah. So now I'm just going to go check QC. That's if they ran. Yes, Bara is just, but the nice thing about Bara is that the results, like the volumes are not so much compared to the Joburg Gen. So that's where the vets registrars rotate, Joburg Gen, Bara, and Helen Joseph, I think, when you're senior, but mainly it's Bara and the Gen. So anyways, I'm gonna go check the result. I'm gonna go check QC and probably do some HB1Cs. Let me switch on this computer actually. And yeah, that is all I'm gonna be doing today. What is happening over there? We have a back end where we check our results before they get loaded onto track. Where the doctors are able to access, like, look at me talking like I'm not a doctor myself. Yeah, so basically where the doctors are able to also view, like when anyone can view anyone's results essentially. So we have our back end where they first, pass through and then, yeah, we authorize. I'll show you guys like how to see a report and what to see at the bottom to see who actually authorized. But I'll show you guys. I'll authorize one of the results and I'll show you how it appears and how you're able to tell that this is the doctor actually authorized these particular or specific results. So techs are also allowed to authorize in other institutions. I know Bara techs authorize, but at the Gen, techs don't authorize. So yeah, that's why it's a lot of work being on call at Joburg Gen. So I don't mind a Bara call. Yeah, I don't. And you stop authorizing before it's late. So honestly, I honestly don't mind. So I'm just logging on before I go down. I just want to see, is there any dodginess? Because then sometimes if there's issues and results were released, then you have to like deauthorize and stuff. So that's the not so nice thing about it. Deauthorize, then you have to find the samples and rerun because you don't want to release results that are not of good quality and stuff, So in here, let me just log in here and then I will grab my lab coat and go to the lab. I don't think I'd enjoy this, surprisingly. I remember when I joined, a friend of mine was like, "Friend, what do you even do in the lab?" I was like, "Nigga, I don't know." But clearly, the interview went that well that they called me back. So probably I have some quality to survive the lab. So Oh, I joined the wrong queue. Okay, let me exit. Yeah, so I was just like, I don't know, the lab's boring. I might watch YouTube videos. I'm joking. I don't watch YouTube videos during working hours. Anywho, yeah, let me go downstairs and not waste time, guys. It's almost 8:30. I need to be out of here by 9:30. Ooh, will I make it for church? I don't know. But I'll check QC and authorize at home. So you can authorize on your laptop. You don't have to be at work. So I just check this, I go home. And then when I'm at home, I'll show you guys the intervals in which I authorize. Like, I'll probably do it every, 4 hours or something. But I know because the volumes at Barra are not so much. But at the gym, next thing you refresh, there's 1,000, 1.5. So it's just, yeah. Mm-mm. It's not So, okay, I'm done with QC. That was mainly last night's QC. They haven't run today's QC. So she's about to do it. So I should just, I'm going to leave at past. That is that. I think that's about, it's not a lot of work really, if I'm being honest. It is definitely better than clinical. So we do have, so weekend calls are literally like this. The annoying thing is that you have to come in and, check QC and but you can authorize from home. That's the nice thing about it. So if there was a way to check QC remotely, if we had access to the computers and stuff that link to the machines, then I think that would be better. I think Cape Town is doing it. Cape Town, Stellenbosch vibes. Yeah. I think they are doing it. So the rest of the other places, you are forced to come into the lab. Whereas I don't think it's going to be necessary in the future. So yeah, and if you guys have any other questions to ask regarding this or regarding pathology, please let me know. Because honestly, it's very rare. Most people who know about it are people who did their ComServe in it. Some of us people who went straight from clinical. So you can either join the labs. Okay, so let me just give you a bit of a lowdown about how to get into the labs, right? So most people who are in the labs were ComServes in the labs, right? So after internship, the normal internship, which is the medical internship that everyone does, some people applied to join NHLS and do their ComServe in NHLS. So the thing with doing that or taking that option, some people will take it because they don't have any other choice, and some people will not. Well, so some people will actually. I think the reflection. So some people will take it because they don't have any other option, but some people take it because they genuinely want to join the labs. So yeah, so if you do your ComServe in the labs, you end up rotating in the different specialties. I think 3 months in 3 months in chemistry. You can choose, I think, 6 months in micro, I don't know. But they split it up nicely so that you get exposure as a ComServe, right? And then I feel like the ComServes have an upper hand in getting rich posts because they already know what is happening in the labs. And the unfortunate thing about the pathology is that unless you have rotated in it or done it, or even at least come to have a visit in the lab or something, then you won't have the knowledge about what basically happens in the lab. So I think even if you are someone from clinical and you want to join NHLS, it is advised that you at least take a day or two, whatever, and then visit a lab so that you see what's happening, because they ask lab-related questions. How I managed to swindle my way into the labs with no knowledge is shocking. But anyways, let me tell you how I did it. So basically, I never knew what I wanted to do or specialize in. Initially, I told you guys that I was into surgical stuff, and I even considered ONG and things like that. And then I realized after working that I don't see myself doing this type of work in the future. So that's when I was looking into non-clinical work. So I did a diploma in HIV. So the nice thing about the diploma in HIV is that it's very, very broad in terms of where it can take you. So it's one of those things that most people, I remember an intern saying this to me, that people who do HIV diplomas, that people don't know what they want to do in the future, because technically it's everywhere. You can do internal med, if you want to specialize in internal medicine or family medicine, it's a bonus, do you know what I mean? If you want to join the labs, it's also a bonus. I know the micro registrar, they make them do the HIV diploma. If you want to if you want to go into like research, it's also very, very important to have a diploma in HIV. So I did the diploma because I was like in between, and I knew that whatever I do, it's beneficial. And with HIV being a big thing in South Africa, So yeah, I did that. I did a couple of other courses as well. I actually wanted derms at some point in time because I'm into things of skincare, because I'm into things of skincare and stuff like that. So I did want to join derms, but then my dream for that got short-lived because I realized that it was never going to happen. Like, there's hardly any posts that are released. There's MOs who've been doing derms for like years and years, who have just been waiting, and I did not want that to be me. I was just like, first of all, I can't compete with someone who's been doing who has an MO post in derms for 10 years. So I was just like, no, let me just be practical. This is never going to happen. So I let that go. So after I realized that's when I started doing things in general that would take me literally anyway. I considered research, so that's why I did that course in research. With regard to the lab stuff, this one day, I don't know what possessed me. I had a lot of time when I was in Eastern Cape, so whenever I told you guys about FPD, sometimes they have these courses that are sponsored by the WHO and all of that. So sometimes you don't even have to pay for it. So this one time I saw this one course in infection control and management, in the workplace, something like that. So I did it overnight. It's not like hard stuff, guys. They will give you a book. It's not even a book, magazine type situation, a PDF, vibe, and you just have to read, and then they ask you stuff, and sometimes you have to watch a couple of videos. So I did it mainly for ethical points because it had a lot of ethics points. I think it had somewhere around 15 to 20, and you know how hard it is to get ethics CPD points, right? So I did it for that. I did that thing, and yeah. And then when I applied for whatever job that became available, I would literally fix my CV for the particular job, which is a very important thing that people have to do. So yeah, fix my CV for that, and then when I applied to the lab, I put that specific course there. The research certificate thing I was still busy with, so I couldn't put that in. I had the HIV diploma, I had an HIV certificate. So basically it's very hard, to get into some of these specialties. Your CV needs to be floral. You have to have a lot of stuff to back yourself up. I know with peds it's impossible. You have to have primaries and a diploma in child health and a lot of other things. So it's very tricky. It's very hard getting into some of these specialties. So anyways, yeah, that's what I did. And the hard thing about being clinical, coming into the lab space, is that it's very hard because you are competing with people who have been working in the labs, like the ComServes. So yeah. So I put those things in, and then I applied. I got a call back, and yeah. I don't know what else to tell you guys about this. If you have any questions, please let me know. With chemistry, it's mainly authorizing. Sometimes it will do therapeutic drug monitoring for the immunos, immunosuppressant drugs and all of that. We do drugs as well. It's mainly that. But the main thing is that you have to know. The annoying thing about chemistry is that you have to know the methodology of the machines, all of that, all the chemical stuff. I thought molality, I left it in first year medicine, but it comes back through and through. You have to know conversions, moles, millimoles per kg, all of those things. You have to know calculations. You have to know molecular medicine is also a big thing, and physiology is also a big thing in chemistry. So we rotate with the mono. So if you're Clin Path, you just rotate, whereas there are people who are mono specialists, so people who got into just heme and just chemistry and just microbiology. So they do it for 4 years. So Clin Path, you do it for 5 years, this whole rotation thing, and you write a big exam in the end. There's no primaries that you can write to get into the labs. That's what I'm saying, is that it's very hard to even get these certificates. I just got lucky that I got that one that was sort of kind of related to labs. But main thing is the diploma, it's infection, whatever, lab related certificates can also be, I guess, beneficial. But other than that, it's not. Other than that, it's very it's about what you do. Sometimes it's about what you know or who you know. So yeah, and you can either work for NHLS, you can also you can work for NHLS, you can work for these private laboratory companies, Empath, Lancet, whatnot. You can start your own lab. You can also go into the route of corporate medicine. that is where the money is. I think when you start your own lab is where the money is, and also when you start your own lab is where the money is, and also when you join corporate medicine, that's where the money is. So yeah, that's another important thing that you can do. If you are a student, you notice that they are the ones who give lectures to medical students. So the doctors here, or the consultants who have specialized, also give lectures to university students, in that they will head up a whole block like endocrine, renal, things like that, because that is the crux and the core of medicine. Let me just wait a couple of minutes, 20 past, authorize these few results, and then I'm going home. So I just wanted to show you an example of how it appears once the specific or particular person is authorized the results. So it looks something like that. So you can see the Maseti AADR registrar. Hi guys, welcome back to my channel. I'm back at home cooking Christmas dinner. So my friend and I are just preparing. Hi, but what's happening? What's happening? Me, girly.
I want to be able to grown up like you and have this.
But yours are so nice and glowing, baby girl.
I want them to grow.